We now have a talk on the significance of strategic advocacy in occupational therapy by Mr. Harshvardhan. He's an overseas guest. He's doing an overseas guest talk. He has a bachelor's in occupational therapy and a master of management in health services degree from Massey University, New Zealand. He's a former president of the National Occupational Therapy Association of New Zealand. He's a board member of the international chapter of AIOTA and a peer reviewer of IJOT. He worked as a program manager for family and community health services of the Ministry of Health, and he manages cross-agency fetal alcohol spectrum disorder action plan of New Zealand. He has over a decade of experience as a clinician, a manager, and a leader, and he has a special interest in governance, contemporary health leadership, advocacy, disability, including FASD, autism, dyspraxia, and sensory processing. He enjoys mentoring and nurturing young practitioners and future leaders. We invite Dr. Harshvardhan on stage, please.
Good evening, everyone. First of all, thank you very much to AIOTA to give me this opportunity to speak. And as you can see, the topic of today's presentation is significance of strategic advocacy in occupational therapy. And the picture which you're seeing is my team back in New Zealand when I was in the association. And this is one of the GB meetings. I hope some of you were there in the GB meeting last night. So a similar event a few years back. And just an update, in my bio, I currently work as a public health lead for the Ministry of Health and in the strategy and policy team. So when it came to suggesting a topic for presentation, I think it is apt that I talk about strategic advocacy. And advocacy has been always my area of interest, and both personally and professionally. And it has been a journey, and I'll try to share my experience. And I may use some stories. I've got a note in front of me with some guides on which stories I want to talk about today. So let's go ahead and see what is there. So why do decision makers pay attention to one thing rather than another? So when we talk about advocacy, basically you want decision makers, and decision maker can be a small governing body, a national association like AIOTA Executive Committee. It can be a local government, it can be national government. And one thing we often talk about is that why they are not listening to me. I have got such a bright idea. Why they are not listening to me? I have done this research and it says that X, Y, Z can be achieved and it will be way more efficient. And as clinicians, we get trained to think in a rational way. We get trained to think that A leads to B leads to C leads to D, the scientific approach of thinking. Unfortunately, when it comes to decisions, when it comes to governance, it doesn't work that way. And sometimes it can be frustrating. I remember getting a phone call from a professor from one of the leading universities in New Zealand. I cannot take his name for privacy purpose. Now, this gentleman and his team had done a $5 million study, and they came up with recommendations, and they wanted the Ministry of Health to implement those recommendations. And so I was on this phone call, and he got totally frustrated why I said we cannot simply go ahead and implement the recommendation. And one of the reasons why I was doing that is his research was not aligned with government priorities. Any government have got agenda. There's so many things. For example, if you have got a child at home, the child will ask, I want this, I want that, I want that. So the child will give you 10 things to get. Out of 10, only you can afford to give 2 or 3. Similarly, any governing body at any level can pay attention to only a few things at a time. So anyway, so this professor, he ended up contacting the minister, and the answer was the same. It came back to us, and we had to write a letter saying that, sorry, we thank you for the research. We have noted it, but we cannot work towards implementing the recommendations. So what I was trying to say is that when decisions get made, it is important to, agenda is really important. For example, yesterday's GV meeting, there was an agenda, and whatever got discussed or decisions were made were as per the agenda. So when you are advocating, it is important to keep in mind is that what you're advocating for, is it on the government's agenda? If it is not on the agenda, how easy or difficult it is to get it on the agenda? If you're doing a research, is it aligned with government priorities? So next one. So this one is garbage can model. I remember I was doing a clinic in those days. I was working on frontline as a pediatric occupational therapist, of course. And I used to do a joint clinic with Dr. Pat Toy. He's a pediatrician. What I was not aware of, that Dr. Toy only worked part-time as a pediatrician. Majority of his time was spent in the Ministry of Health as their chief advisor for child and youth health. So I was talking about, in those days, I had just got involved in the Occupational Therapy Association, and we were making some submissions, advocating for things, and of course, getting frustrated that why government is not listening to us. And Pat said something, he said that, have you heard of garbage can model, or have you heard of Kingdon model? And I said, no, I haven't. So I went back and read about it. So basically, if you look at this study by Kingdon in 2003, he talks about a garbage can model, and that is how most of us perceive about decision. And I was listening to some of the comments in the GB meeting last night that I don't know what happens there, who makes decision. And so this is a common perception, is that decision making is like a box. You put problems, you put solutions, and then there are decision makers, and you do not see what happens inside the box, and a decision gets made. So this model was given by Cohen, March, and Oslin. That's why the name. But then later on, Kingdon said, wait a minute, there is more to it. It's not completely garbage or a black box. Sorry, is it? I'm trying to change, but I don't know whether. There's. I can use this. Okay, I'll just use this one. This works, yeah. Sorry about, there was a technological glitch. So this was the slide. You can have a look. At least you can see the color and the design. And I'll skip to the next slide. This is the garbage can model I was talking about, that most of us think that decision makers, they put things into a box and a decision gets made. We do not get to see how the decision has been made. But Kingdon in 2003 said, wait a minute, there is more to it. We at least know something about how decision gets made. So this is where it is. So I was talking about Dr. Pat Tui, and when he described decision making, because he was at the time working within the ministry, I was involved in the Occupational Therapy Association as their president, and I was an advocate. So I'll explain you where I was there at that time. So if you look at that diagram there. So there are three streams of processes in agenda setting, and one is political stream, the other one is problem stream, and then there is policy stream. So, and then there is policy window. What I'll do is I'll go to the next slide, and then I'll come back to the previous slide once again. So problems stream. So why do some problems come to occupy the attention of government more than the others? It can be the magnitude of the problem. For example, COVID-19. All of a sudden, COVID-19 came, and with the numbers and the magnitude, that encouraged government all across India and even other countries to act swiftly and do something about it. It can be incidence of a disease, as I said, cost of a program, change in condition. It can be a disaster or a crisis. I'll give an example. What happened is that, so one of my work involves looking after family violence team in New Zealand. So there was, so I was on holiday in Queenstown with my family, and suddenly there was shooting in Auckland. And this person went out and just randomly started to shoot people. One of my colleagues rang me and said, Harsh, we have to be prepared because this will lead, this will instigate advocates. I was like, why this would happen? A reason was that the person who was shooting, a few months back, he had gone to emergency department and he had complained of mental health issues and he did not get the treatment. Now, when the shooting happened, all of a sudden, the advocates, the mental health advocates, nurses and all, they saw that as a window of opportunity, of course. And then they were demanding of what is the government doing to screen for mental health in emergency department? Why do we do not have mental health nurses? We need more mental health nurses. So this is how it works. Suddenly an incident happens and that becomes a priority and everyone starts talking about it. And of course, there is a difference between a condition and a problem. So Occupational Therapy Council was not there in India, it was a condition. And that condition was for ages, for many, many years. It became a problem when government decided that allied health needs some kind of regulation. And it happened in the environment of COVID-19 when health professionals were needed. And then a need was felt that they need to be regulated well. So coming back to it, that at a time, government can pay attention to only a few things. So when you are advocating, it's about knowing what are the few things government are paying attention to at the time. And how can you be in that process? How can you be involved in that process? The second stream is politics stream. Now this stream is very, very visible. Politicians, so I'm talking about the political stream. So politicians are, of course, they are verbal, they will speak, they will give speeches, you will hear about them in media. You might be seeing the new slogan, Developed India or Viksit Bharat. So this is an indication that in the next election, that can be the major part of manifesto, Developed India. So if I was at your place, I'll be thinking, when India will get developed, how can occupational therapists help in that process? Or if India is developing, or what is happening with occupational therapy in other developed countries, what policies India should be making to fulfill the commitment of being a developed India in terms of occupational therapy, in terms of health. Other factors like national mood, election outcomes. Well, yesterday there was an election of president in AIOTA, and now we have got a new president-elect. Now, election outcome would impact how EC works in the next 5 years, and they might have their own priorities. So this is how it works. Governance, whether it is at a small board level or a national executive committee of IOTA level or a country level, the basics remain the same. And each of the political parties, they have got their manifestos. I'll come to the manifesto of 2019, which is the BJP manifesto. But before that, just wanted to quickly touch that. I don't know whether you noticed or not, BJP manifesto talked about Sabka Saath, Sabka Vikas. You take everyone, inclusive India. And from there, it came a new term which I saw, which came in there was Divyang Jan. And from there, inclusiveness came. They talked about how they want to screen for disability in Anganwadi services. They talked about the quality of life of elderly care. So if you are an occupational therapy researcher, if you're doing a research, if you want your research to be heard or your research to make difference, if I was at your place, I will align my research topic with the manifesto of the government. So what happens is that any new government is formed, they come there with a mandate from people, they come with a manifesto. When they come in, they will call officials, they will call secretaries, and they say, look, this is what I want to achieve. I want to achieve inclusive India. Go and make it happen. What they will do is that the officials will go and they will operationalize it. They will employ or contract with consultants to write policy and make it happen. And that is the window of opportunity when that is happening. So it's thinking about how you can get involved in that process. Vocabulary is very important. So when you are advocating in a BJP-led government, I'm trying to just focus on in the national at the national level, because there are many states and it is easier to just give one example which covers all of the states. So if you want to advocate in BJP government, and if you want to do something, if you use a vocabulary which Indian National Congress uses, they will not hear you. So for example, Congress manifesto said a right to health, right to free healthcare. So if you're writing a letter to Prime Minister and saying that, you should do something about disabled people, you should do something about the Divyangjan, and you say it is their right to get a free disability service, that will put you at disadvantage. I remember I myself doing so. So in New Zealand, we had right government, and they had a vocabulary in their manifesto. They were talking about we will do social investment to enhance quality of life for those who are socially disadvantaged. But what happened is that I wrote the letter, and the new government was from the left, and they had a new vocabulary. They talked about equity, not social investment. They were very against social investment. So as an association, we wanted to meet the Prime Minister. It never happened because I used the wrong vocabulary. It was way back, and this is a lesson for me. So try to use the vocabulary which aligns with government priorities and agenda. Policy stream, mainly I wanted to talk about policy stream. This stream is, if you look at this diagram, this is like a black hole. No one knows what is inside there. I came to know about it only when, from an advocate, I became a civil servant working for the Ministry of Health. Then I was involved in policy work. So any policy, when it gets made, they employ consultants to write the policy. So if you are an OT, you have to think about, can you be a policy consultant? They will go to private companies like Deloitte and PwC, and they will employ them to write health policy. So if you guys can do so much, such wise work and research and all that, you can definitely write policy. So thinking about how you can use your skills, and I'll be around. I'm more than happy to talk more about it. I'm running short of time. This was a 15-minute talk. It's very hard to summarize your life journey in 15 minutes. I'm trying my best, but I'll be there to talk to you. So I was talking about policy window, and this is really important to consider. And for example, yesterday in the GB meeting, it was a policy window to get GB agree to consider, the EC agree to consider 2 additional GB member. So that was the window everyone used, and you saw what happened. If you're in the GB meeting, you would know what I'm referring to. So that is how decisions get made. Looking for that right time where you can put forward your solutions. We have got an advocacy and policy committee in international chapter, and we do proactive and reactive advocacy. And so this is how advocacy should be. And there are some of the things you can look in the slides. This is, I'm not canvassing from Prime Minister Modi, but this is from the last year, the manifesto. Caring for elderlies, enabling Divyangs, and look at the vocabulary they have been using. Anganwadi and preschool, they want to screen. Would you like to do a research around screening for disability in Anganwadi? Any one of you? If I was at your place, I would do that research. And I will send that research to the Prime Minister's office. So these are some of the visibility and advocacy I did, submitted at Parliament, and you can go to these links. And this was around when government were funding psychologists for mental health. And we came up with this publication. This interview was around more doing, not just talking therapies needed in mental health. Some of the other work, advocacy work we have done. As I said, I'll be around. Thank you very much. I'll stop here. I have already exceeded, I think, a few minutes. I'll leave here. Thank you very much. Any question? I'll be around. You can talk. Thank you.
Thank you, sir. Thank you for the nice presentation, and we really need to advocate our profession. Thank you. I would like to request Dr. Shobhan Shah, sir, to please come on the stage and felicitate Dr. Harshvardhan.